afternoon. It's another Wednesday with your fertility specialist. Are you excited? Like I'm excited. Yes. So, on behalf of Alps Hospitals, welcome you to another day with your fertility specialist. We love to say a very big thank you to our dear viewers. Thank you for liking our post. Thank you for sharing. Thank you for staying tuned. Please do call someone up right now as we're about starting. Share the link with someone. Make sure if you need to send data to someone, please do that just to make sure they are able to get every information you're about to get right now. I remain your host, Gogo, and it's always a pleasure to have you with us every Wednesday. Yeah, so what's popping? You know what's popping. Yeah, we've been talking about genotype for the past 2 weeks. That's because of a lot of mishap that's been happening with genotype. And yes, we've been getting a lot of feedback from you, our dear viewers. We would also love to say thank you for engaging us. Yes, and we're here to definitely meet up with your demands, answer your questions. So feel free to drop your questions, your thoughts, your opinion in our comment section. We're talking about genotype and fertility. So we have the fertility specialists with us today. We have Dr. Kenneth Eguda. He's a consultant gynecologist. I will not say so much just for time, but you could always revert back to our other videos. For someone watching for the first time, he's a consultant gynecologist, he's an IVF specialist, a minimal access surgeon, and many more. Like I said, you could get them from our previous videos. So for the purpose of our time, we'll just go straight to the point and we'll hit the ball rolling. Today, we're talking about genotype and fertility. I love to say thank you and welcome to Dr. Ken. It's always good to have you with us every Wednesday.
Yeah,
Thank you
thank you so
for
much.
coming around today. I know our dear viewers. Okay, so we've been talking about genotype and all that it has actually caused, the mishap that it has caused in our society today. So we want to see let's talk about the understanding and perception that people have about genotype in Nigeria, in Africa, or even globally at large. When you say this genotype, how do they see it, or what's their opinion about it based on your knowledge and your assessment so far?
Yeah, people actually don't really understand what genotype is all about,
Mm,
especially the sickle cell genotype, the
mm,
SS genotype,
genotype.
and then they don't know the implications of this SS genotype.
Mm,
A good number of them just feel it's just what God has created,
mm,
and then if they get it, it's just their lot in life.
mm.
And so, even when they make choices involving genotype mismatch, they just
Yes,
feel it's just what is destined for them,
for them.
And
Mm.
so because of this, they go on making these choices,
Okay.
and then making babies with
Mm.
these poor choices,
Wow.
and then having babies with sickle cell SS genotype,
Yeah.
and then the cycle goes on and
And
on
on.
and on
Mm.
and on. And even when the baby is born and the baby falls sick,
Mm.
these ideology of it's what God wants.
Mm.
what the deity wants, makes
Yeah.
them accept it, and then the
Mm.
baby or the child lives with this eternal suffering
Suffering.
for those that
Mm.
have frequent crises and all of
Mm.
that. So one, they feel is just God who gave them those those destinies, you know.
Mm.
Yeah, but then I think the truth is this, that it's just an accident of nature. It can't be
Yes.
avoided, you
Mm.
know, and it's all based on knowledge. I don't think people should depend on God for this knowledge. The knowledge is in human domain, and so they should
Yeah.
use the knowledge to their own advantages.
That's
Because
right.
even those who claim, I've seen a good number of them who claim
Mm.
God asked them to get married.
Married. Mm.
I look at them and say, you think you know this God more than I do, right? I
You're
get,
cooking as
I,
a pastor.
I tell them, yeah, you guys may see God in the churches,
Mm.
but we see God in the laboratory.
Mm.
You know, let me just tell you something. My daughter, for instance, is in love with science,
Okay.
and for the past week, we've been talking about DNA
Okay.
and RNA. Rather, that's what they were taught in
In
school,
school.
and so she
Mm.
find it very fanciful.
Mm.
And I've been crazy about the human genome for a long time, you know,
Yeah.
and I take them to give lectures in the universities, to listen to researches,
Mm.
and so they love those sciences.
Yeah.
And I asked her, now that you understand what RNA is,
Mm.
DNA is, and all the proteins associated with
With
all these
gene.
molecules,
Mm.
what do you think about the DNA
Mm.
and all of this? She said,
Yeah.
you know what, Dad? It makes me feel I understand how God created humans.
Okay. Wow.
I'm telling you, this a 12-year-old girl or some
Okay.
13-year-old girl.
Wow.
You know, I was just wondering, I say, man, so now you are getting there. You know, so you see, all the things we perceive about life
Yeah.
is about the knowledge we have of them.
Yes,
And of
that's
course,
right.
knowing how this abnormal genotype occurs or is formed or happen
Yeah.
makes.
Okay, so now you talked about the genes. Maybe we should say a little of how much of a role gene plays in family history and also in fertility.
Yeah, with family history, you know, a child looks like his parent,
Mm,
and the parent looks like their look. I mean, and the parent looks like their ancestors.
that's right.
You know, so this gene is passed from generation to generation. That's why we go talking
Generation.
about the family tree, the pit tree,
Mm,
and all of this. You
yeah,
know, because you can't inherit anything from me if you are not linked to me.
that's right.
You understand? So
Yes.
um the genes is just what makes us up, what makes our family up, what
Mm,
makes us look like what we look, what makes us behave the way we do behave,
mm,
and what makes us fall to certain condition. So
yeah,
it is what makes us who we are. That is the
that's
genes,
right.
you know, or the DNA if you want to take it that way. And then if you want
Yes.
to take it on the bigger platform, the genome, what makes us
Mm,
completely who we are. And the
mm,
sickle cell is part of that. Some
yeah.
of us don't have it,
Mm,
but some have it. And those that have it can consciously work not to perpetuating these genes
mm,
by the choices they make, you know, and
yes,
by the way they go about getting pregnant.
that's right.
So that's it.
Okay, so
And
you
then
see
it
the.
affects fertility, for instance.
Mm,
Gene affects fertility.
okay, wow.
I've seen women
Yes.
who stop having eggs
Hmm.
by the age of 30, for instance.
Wow.
And it happens in the whole family.
Family.
You understand? So
Wow.
it means they genetically predisposed to having premature ovarian insufficiency, or what they call
Yes.
ovarian failure.
Failure.
And have
Okay.
seen ladies that all have polycystic ovaries.
Ovaries.
The
Wow.
mothers have polycystic ovaries,
Hmm.
and all our daughters have polycystic ovaries.
Ovaries.
And these are
Wow.
all the things that have effects on
Fertility.
fertility. You've
Yeah.
also seen mothers having fibroids, their kids having
Hmm.
fibroid, and
Yeah.
their aunts, and all of those having
Yes.
fibroids, because
So
these are
it's
all genetics. So this
yeah.
is how gene affect fertility.
So you see, it's so maybe now we should say when you are trying to also get hooked up with someone, maybe they should also check their history so you don't also predispose your offspring to possible things that could be linked to the other person's history, just in case you don't have that in your family
Hmm.
history as well.
Hmm.
Okay, so today maybe we should talk before, because now we're just trying to have a center where we'll now finally talk about the impact of genotype on fertility. But maybe we should just say a little about what more like what the biology of a woman's fertility in relations to a man's fertility. Just maybe to tell us a little about the woman's fertility life. What makes a woman fertile, or when do you say a woman is fertile? When do you say a man is fertile? What are some of the things that you could look at?
All right, now talking from a reproductive perspective,
Yeah.
a woman is fertile when she can produce good eggs,
Okay.
and this is age related,
Mm.
and the age is not uniform for
Mm.
everyone.
That's right.
Once a
Okay.
woman can produce eggs, she
Mm.
is fertile. Whether she has a uterus or
Or
not,
not.
she is fertile. So long
Okay.
as she can produce eggs.
Eggs.
Whether her
Okay.
fallopian tubes are functional
Or
or
not.
open or not,
Mm.
so long as she has eggs, she is fertile.
Okay.
Because what
Wow.
is the end game of fertility?
Mm.
Ability to produce your like. And
Yes,
if you
that's
know that
right.
your kind or your like doesn't have to be carried in your own uterus, it
Yeah,
means you're fertile when you just have eggs.
that's right.
Okay,
Oh,
so
wow.
a woman is fertile
Hmm.
when she's able to produce good eggs to bring about pregnancy.
Please make sure you are taking notes, dear viewers.
So for
We're
someone,
getting
okay, for
another
someone like us,
perspective.
you know,
Mm.
some guys actually ask their girlfriends to check their fallopian tubes before they get married.
Oh my own.
There was a time that a couple visited me from a church,
Okay.
and that they were undergoing marriage seminar or counseling,
Counseling.
and that
Mm.
the pastor asked them to check if the waist of the woman is straight.
Oh my goodness. Wow.
So when he said this, I was like, okay, now what are we
Mm.
looking at?
Wow.
So from my knowledge of obstetrics, for instance,
Yeah.
I guess maybe they were trying to ask whether she has a gynecoid pelvis, because we used to talk about
Yeah.
gynecoid pelvis. When
Wow.
when we're in school, there, 50 year medicine, we
Mm.
just started doing obstetrics and gynecology there.
Okay.
50 year medicine, University of Nigeria, you know, and when my guys go to date girls,
Yeah.
then we just make fun of it. I see that girl you're dating. Does she have
Oh my god. Because of the knowledge you've had.
the knowledge is so bad and it affects everything we do?
Honestly, you
Does she have a
really.
gynecoid pelvis? Because already because we are wired to think that way.
Yeah, that's
When I
right.
wanted to start dating ladies, for instance,
Mm,
I was in a 400 level
mm.
medicine. So I was sure I was going to graduate as a doctor. So I went to the laboratory first
Yeah.
and have my genotype
Checked.
checked.
Mm.
And so Ken is AA. So I'm
So
ready
you
to
can do
go.
as you like.
I can go any direction, you know. So yeah, this is just on a lighter note.
Yeah,
So
yeah.
these are important. So when a lady is has eggs
Yes.
and the eggs are good enough,
Mm.
she's fertile. Whether she has a uterus or not, or the fallopian tubes are open or not, she
Yes.
can get pregnant. You know,
Yeah.
someone else can bear the pregnancy, and so
Yeah.
she's fertile.
Yeah.
But then the age range of fertility varies with women.
Women. Mm.
Women were born with about 400 to 700,000 eggs, and they
Okay.
lose these eggs monthly
Wow.
when they don't even get pregnant.
Oh.
And so as they're aging, the number of eggs they have left is reducing.
Reducing.
And the eggs they have left as they're aging is of lower, poorer quality than the
Quality.
one they have lost previously.
Wow.
So they get to a point in life where their eggs are no longer too good for conception. Then
Yeah.
back to the man, we can't say so much beyond this.
Mm.
And so women have will have the biological age and
Yeah.
the chronological age.
Age.
So for
Okay.
us in fertility care, the biological age is it's what we make reckon with.
Mm.
Just like a woman can stop seeing her menses when she is 50,
Yeah.
why some stop seeing menses when they are 38 years.
Yeah.
And so you see,
Mm.
you just wonder. So they're all in menopause already, but menopause
Yes.
hits them at different
Different
times. So it means
times.
their
Mm.
fertility lifespan is
It's
different.
different. That's
Again,
right.
then for the man,
Mm.
fertile when he has good enough sperms to make a woman pregnant.
Pregnant. Mm.
And just as women have biological clock,
Yeah.
yes, I'm happy to say, or sad to say, that men also have biological clock
Mm.
because men are a lot fertile when they are younger. By
Mm.
the time they
Wow.
get to 35 years and beyond, they may
Mm.
still have sperms,
Yeah.
to play
Mm.
around with in millions, but the quality
Okay.
of the sperms with respect to making pregnancy
Pregnancy.
and
Mm.
health of healthy babies is
Mm.
declining.
Wow.
So right now the movement is towards asking even young men who are not yet in need of babies
Babies.
to freeze their
Yes.
sperm when they are getting
Wow.
advanced in
In the
age.
age.
Because the
Okay.
older you are as a
Mm.
man, the more likely you are also going to have abnormal babies because of sperm abnormality. The more
Wow.
likely your wife or your woman may be having miscarriages because of poor sperms.
Okay.
And the
Wow.
more likely you're going to have babies with autism and some
Mm.
syndromes. So
Wow.
aging affects men, just that
Okay.
it's not yet as loud as we all know about women. So the
Women.
science on men's sperms is
Wow.
actually improving.
So wow. There's.
So that's fertility, and
Mm.
sickle cell have a bearing on all of them. Sickle
Yeah.
cell lowers the reproductive tendency of women
Mm.
as much as it lowers the reproductive tendencies of men. When
Wow.
you have sickle cell and you have a lot of crisis, the blood supply to the ovaries are interrupted intermittently,
Okay.
and the
Wow.
function of the ovary
Mm.
is dependent to a large extent on the blood supply. The
Mm.
same thing goes with the sperms, with the testicle, because these are end
Okay.
organs. I
Mm.
know
That's
sickle cell
right.
frequent crises block supply of blood to end organs, and that is
Yeah.
why they can have chronic kidney disease,
Wow.
you know, distal limbs, blood shortages,
Yeah.
and the supply to end organs like the
Mm.
kidney, I mean the ovaries and the testicles are low,
Yeah.
and the
Mm.
lower the supplies, the less functional
It
these organs
is.
become. So you can see sickle cell affects fertility
Yes.
to a large extent.
Extent. Wow.
But that doesn't mean they don't get pregnant. They can get
Mm.
pregnant,
Mm.
but their fertility span is lesser
Okay.
than the
Wow.
fertility span of those who don't have sickle cell. In this case, we're talking about SS genotype, not the
Yeah.
AS, because the
Mm.
AS are super normal.
Yeah.
Yeah.
Okay. So you see, he has just pieces this knowledge that maybe you would need weeks or months or years to get. He has just said this now on one go on one sitting. This is just so much. Like I've learned so much, and
Yeah,
I know
that's
you
because
do.
I'm a sickle cell specialist.
Yeah. Okay. So a lot has actually been talked about healthy lifestyles, but what's your counsel to dear viewers with regards to their healthy lifestyles as a whole? Lifestyle that would actually increase or improve their lifespan, that makes them okay, should I say just say that makes you feel like you're healthy. What are some of the lifestyle that they could actually imbibe to help prolong lifespan and then probably just help them live healthy? Yeah.
You mean the sickle cell
Sickle
people?
cell and then even our dear viewers as a whole, because I know we have not just sickle cell watching as well.
Well, it's a very difficult question for me now to
Mm.
answer. Do a lot of exercises. If you're healthy, do a
Mm.
lot of exercise that is good enough for your cardio, for your heart,
Yeah.
under the guide of a trainer or a
Mm.
heart specialist, so you
Yeah.
don't run yourself into problems too.
That's
Because when you
right.
exercise, you burn down, you take out a lot of oxidative stress, make
Mm.
out time to rest and time to sleep, And more importantly, we have a lot of food crisis in the world.
Mm.
One extreme is starvation. The other extreme is overnutrition. You know, the
Yeah.
overnutrition has its own negative effect on fertility because when you have fat, when you are obese, for instance, obesity affects development of sperms.
Mm.
You know, just as obesity affects development of eggs.
Mm.
Eggs of
Wow.
obese women, for instance,
Yeah.
have abnormal. Let me use the word abnormal cells.
Okay.
Yes, because they have a. I have no simple word to use here now. For those who do biology, for instance,
Yeah.
yeah, you know, in the process of cell division, we have what we call mitosis, and then we have a spindles. So
Mm.
obese eggs, the female,
Yes.
tend to have excessive, more than normal,
Okay. Wow.
mitotic spindles, and so
Okay.
that affects the quality of eggs, and
Yeah.
then affects the rate at which pregnancy stays,
Happen.
makes
Wow.
them have miscarriages quickly,
Okay.
and then fertility is lowered by this because you have a lot of abnormal fertility processes going on in
Mm.
the obese people. So eat healthy, exercise, burn the calories that are not necessary, you know, and be healthy. And for the sickle cell, stay away from any conditions that predispose you to crisis.
Crisis.
Avoid mosquito bites if you're living in Africa or in Nigeria.
Mm.
You know,
Yeah.
avoid unnecessary emotional upsets. You know,
Mm.
stay clear from conditions that give you respiratory disturbance,
Distress.
like
Okay.
excessive cold and all of this, and
Yeah.
stay away from fumes that cause respiratory distress,
Yeah.
because any of this could just trigger crisis, and the more crisis you have, the lower your fertility potential, whether you are a guy
Yeah.
or a lady, you know, with
Mm.
respect to sickle cell.
Mm.
So there's so much to say about being healthy. And then if you can get pregnant quickly.
Mm.
You know, yes, that's what we need to talk about here, because
Mm.
getting pregnant early in life, if you are disposed to having it, is better, because sometimes I see ladies who are already 38 years, you know, they married at 38,
Mm.
and then they visited me, and they said that we want to just have fun, and then after 2 years we now start thinking of having babies.
At 38.
Yeah, that's because
Wow.
they don't know.
Oh,
You know, they
wow.
don't know, because at 38 you already have poor eggs.
That's
So
right.
why giving more time to
Yeah.
have poorer eggs? You
Hmm.
know, so you make decisions out of ignorance and make fertility potentials very, very low for yourself. You know,
Yeah.
this is not to say women don't conceive at the age of 40. They do.
Mm.
Even up to 46, you can
Yeah.
conceive spontaneously. But the proportion of women conceiving at those ages are
It's
very,
very
very low.
low.
And then the chances of having abnormal babies is
Yeah.
higher at those stages. So
Mm.
get pregnant early. And if you can't get pregnant early, whether you're not ready or you're not married yet,
Mm.
consider the option of freezing your eggs. Because why would you have getting pregnant with poor eggs at
Mm.
advanced age when you have hundreds of thousands of good eggs
Yeah.
at your young age? And you know, babies conceived with good eggs are better quality
That's
babies
right.
than those conceived
That's
with
right.
poorer eggs
That's
and
right.
poorer sperms.
Mm.
That is where the autism and all of
And
those
all.
abnormalities
Mm.
come from.
Okay.
I was
So
conceived when my mom was very young, you know.
okay. So high quality baby.
And I mean it, I'm serious.
Okay.
She was quite young when she gave birth to me.
Okay, that's a plus to you. Okay, so maybe now speaking of sickle cell, are there some drugs that they could take, or are there some medications that they usually recommend for them to slow down or reduce the crisis that they do have?
You know, now, I guess last week we talked about treatment for sickle cell. You know, we talked
That's
about
right.
bone marrow transplant, which is
Yeah,
the most accessible form of care we have in Nigeria, and
yeah.
yet m-
Many people are
more
not
than ninety
able to
percent of sickle cell
access it.
warriors or
Yes,
patients in Nigeria
yes,
cannot afford it, because
yes.
those choices were made by parents who have no financial capacity to even
That's
care for
true.
what's coming after them. Okay,
That's
so they
true.
suffer and
Mm.
all of that. So now there are medications,
Okay.
you know, that have been produced by Pharmaceutical Association Society of Nigeria.
Yeah.
You know, one is Nicosan. And
Mm.
what this medication does is that it reduces your frequency of going into crisis.
Okay.
Because the
Wow.
main problem with sickle cell is a crisis. It
Wow.
reduces your frequency of going into crisis.
Okay.
Now, I don't know so much of those medications because I don't know how readily available they
They
are,
are.
but this is popular in Nigeria, the Nicosan.
Mm.
The other medications are the supportive medication. You give them it's a folic
Folic
acid,
acid. Yeah. Mm.
regular folic acid,
Acid. Mm.
to take to keep building their blood because
Blood.
they are always
Yes.
low on blood. And
Mm.
then when they are low on blood and they get pregnant, you have a intrauterine growth restriction. That is, the
Retardation.
baby fails to grow to the maximum potential in
Wow.
the uterus, and that can
Hmm.
affect this baby even outside life,
Outside.
because
Wow.
babies born following intrauterine growth
Retardation.
restriction
Yeah.
usually have hypertensive complication later in life, have
Wow.
problem with uh with with uh even their intelligent functions,
Mm.
you know, then they could also give birth to kids like that, whether or
Wow.
not they are
Ah,
sickle cell
sickle
or
cell.
yeah. So
Hmm.
you understand.
Wow.
So
Yes.
so it's not a good thing. The
Hmm.
way your pregnancy is may affect what your output in life eventually would be.
Hmm.
You know, so those are some of the things. So they take anti-malaria prevention medication. I mean,
Okay.
malaria preventions
Okay. To prevent.
therapy.
Okay.
That is
Okay.
anti-malaria prophylaxis.
Yeah.
I
Hmm.
think in Nigeria we have the palodrine or something
Okay.
that they
Hmm.
take
Okay.
often and often. But
Just to
the
prevent.
problem is this: they battle
Hmm.
with a lot of depression because you start taking drugs every day of your life.
Life. Oh God, it's just a
Every
sad
day you
one.
take one drug or the other, and then when it gets
Yeah.
so bad, you get into vices if it's because of
Yeah.
pain, and
Mm.
then of
No.
course you are maligned in the society, and
Yeah. Hmm.
if you want to talk about the social life, sometimes people just tactically avoid them,
It's
which is
just
very
a.
terrible, very
Yes, really,
terrible,
it's a
you
sad
know
one.
and some are lucky to get married,
Mm.
but some are just maligned.
Yeah.
Some are just
You just
maligned.
feel like so they are just
It's just
living
living.
as the day comes. Oh,
Exactly. So
it's
they live
just
with depression and a
a
lot of
lot.
psychological
Hmm.
traumas. So those are some of the drugs of prevention. But of course, the current drug, the gold standard,
Mm.
is the cure itself.
Yeah.
Which is what CRISPR actually offers. CRISPR is available in the United States. It's available in the United Kingdom. Some Africans living in these societies have been cured.
Benefited.
But the last I checked,
Hmm.
boy, the cost of this treatment was scary for me to even listen to,
Wow.
because we correlated with the center, and
Hmm.
when we made the conversion of the
Oh
monies
no.
in Nigerian currency, it was over 120 million Nigerian naira.
Wow.
Yes. How
Wow.
many Nigerians can afford that?
Wow.
It
Wow.
takes a state or federal government to sponsor such kind of treatment.
Yes,
The money
that's
is too
right.
big. So,
Honestly.
but that is the
Wow.
cure, and people have been declared cure. And why I love genetic medicine is this.
Hmm.
To be very candid with you, if you if you take back my time, back to when I was 16, 17, going to the
Hmm.
university,
Yeah.
you know, I wouldn't do medicine.
Okay.
Yes, I'm going to go into microbiology or biochemistry, and I'm going to
Okay.
specialize in gene medicine.
Okay.
You understand?
Wow.
Because that is the future of this medical profession. Because
Yeah.
you see, CRISPR cuts off that gene
Yeah.
and replace it with a healthy gene
That's
from the
right.
genome.
Mm.
And so it doesn't manifest. And then you
Wow.
don't transfer that gene abnormality to the
Yeah, to
next
another.
generation. So
That's
it ends with you. There
wow.
is also possibility to switch off a gene,
Okay.
like you're switching off a light bulb.
Oh
I mean, a
wow.
light switch.
Yeah.
And the gene is there,
Mm.
it stays inactive.
Wow.
These are all things that can be done with the
Mm.
human body. And then why I like it so much is this. I'm a Christian, for instance, and I believe in the sanctity of creation
Mm.
and the sanctity of human life.
Yeah.
But I grew up in the laboratory, you know, or in the operating room, for instance. My life has been in the hospital, you know, as far as I can remember.
Yeah.
And I know that I understand the human body so well, so much more
Mm.
than a lot of people living on earth.
Yeah.
And I knew that these are not made by God, because
Mm.
I believe in God. I believe in in the story of creation, you
Yeah.
know, and I believe that these things are accidents,
Mm.
and then they can be corrected.
That's
You can
true.
slice off a gene and
Wow.
reconnect a healthy gene. You can
Okay.
switch off a gene and make it not to manifest.
Wow.
You can redesign a gene
Mm-mm.
and make a human look different the way he looks.
Wow.
And you can make sickle cell end. But the
Yeah.
problem is this: there has to be a research ability,
Yes.
research funding, and
Yeah.
government and political will to do all of this.
That's
But as I
right.
speak to you, all of these are available within the human domain,
Okay.
and people are benefiting from it. So
From
this
it.
is a cure we can see, because even if you do the bone marrow transplant, it's invasive. You take immunosuppression,
Mm.
and how many people have been declared cured by this anyways?
Mm.
You understand?
Wow.
So those are all the things we have to look at. So it has cure.
Mm.
It can be managed.
So,
Yes.
for the sake of someone watching, I know they always say prevention is better than cure. So, maybe you could tell us a. I know you had talked about this in our last class about PGD and also what are the possible ways that we could, because I know I have a first time viewer that's watching right now, possible ways that we could prevent this mishap of sickle cell disease from happening.
The first place is in a public health, for instance.
Mm,
What you do first when you have such disease condition, like when we had COVID,
mm,
you know, uh, try to prevent infection with COVID by wearing the
yes.
nose masks,
Mm-hmm.
and for those of us who were surgeons then, wearing the face shield,
Yeah.
having the airflow in the operating room
No.
redirected with pressure positive and all
And
this kind
all
of
of that.
pressure to
Wow.
avoid the air contact from a COVID
Wow.
patient.
Can
So all
imagine.
of that. So prevention, it's better than cure,
Mm.
if we want to use that word here now. This is
Yeah.
one case, because now we're living in sub-Saharan Africa,
Mm.
and we know one of the major problems we have is we depend largely on the Western society for everything.
Yeah, that's
But the
right.
only thing we can do for ourselves is to prevent it. And
Yes.
one of the ways to prevent it is by making, first of all, right choices.
Mm.
Marry right.
Right. Mm.
Have a right marriage. You know. So I don't want to talk about religion, but whatever it takes to have a right marriage, have a right marriage. Because I don't think there is any love. If two couples, I mean a couple is in love
Mm.
and they make stupid decisions and bring in a child into this world who is going to suffer eternally
Mm.
and eventually exit the world out of suffering,
Yeah,
it makes
it's
no sense.
mm.
The right choices is number one. But
Wow.
for those who have the means, I tell people that this love is a costly love. If an AS and an AS wants to get married, it is a costly love because you have to commit to doing the right thing. I
Yeah.
don't think they should be stopped, but they
Mm.
should be counseled
Yes.
to know what they're doing.
Mm.
And of course, at some point, I think we should think, if it is right for the government to stop them, stop them. But then they have the responsibility to bring in healthy babies into this world. And
Yeah.
one of the ways to bring in healthy babies is to do the pre-implantation genetic diagnosis, IVF, which
Mm.
is what we offer to the couple who canceled their marriage
Yeah.
just recently. In
Mm.
that case, you can get healthy babies that are not sickle cell. So long as pregnancy happens, these babies will not be sickle cell disease babies.
Yeah.
That way, you can do your love life, but you bring in healthy babies. One of the ways is to have IVF with gamete donation,
Mm.
if gamete donation is permitted in the environment where you work. But I
Yeah.
think for health reasons, yes, you could do that and have healthy babies.
Mm.
I know some do chorionic villi sampling, where you get to the placenta and that's for genotype. And
Yeah.
then if you find out that it's genotype, for those who have the morals to do that, you terminate the pregnancy.
Mm.
But how many pregnancy do you want to terminate?
Exactly.
So go down to prevention,
Mm.
while we're hoping that CRISPR will find its way to
We,
Nigeria,
yeah.
and
And we get affordable.
we'll get affordable healthcare.
Yeah.
Yeah, that's
Oh,
what I think.
okay, so for someone watching, you've heard a lot about the ways that sickle cell disease could be prevented. Like in this context, we are saying prevention is better than cure. But yeah, if you feel you could afford the costly love, you could get into it, but make sure you do everything to prevent having a sickle cell baby. For those that are sickle cell fighters, we sympathize with you guys. We know you're going through so much. And I know even as a sickle cell person, you never even want to birth a child that will have to go through what you're going through. So we really do sympathize with you. And somehow we pray that God continues to see you through this challenging period of your life, and may you continue to cope well. May you continue as we wrap up today's chat.
Yeah.
Just a little, should I say, yes, and like I'll always say in one sentence, just give them a little to should I say a little, I'm trying to look for the right word, but well, in one sentence, just tell them something about their fertility and their genotype as we wrap up.
Incidentally, I don't have anything to say about fertility and genotype.
But I know you definitely have something to tell them.
Yeah, what I want to say is that I look for a future
Mm,
where humans will be perfect.
mm,
I'm not talking perfection in terms of behavior or something. Perfection in terms of the genetics of
yeah.
human.
Mm.
I remember for the past 8 to 9 years, uh, on my WhatsApp status, is it
Yes,
status?
your
You call that
display. I know there's this
setting
sentence
and
that
all
they
of
have.
them.
Yeah.
Yeah, it's CRISPR making humans perfect again.
Mm,
That's the era we're getting into now. For those in the digital world, it's coding and a digital business. That's what's
yeah.
reigning.
Mm,
For those of us in the genetic world, it's the genetic coding, understanding the code and
mm.
manifesting the code. And I
Wow.
want to thank Bill Clinton, for instance, for the
Wow.
statement he made 2000, in the year 2000 in
Mm,
the White House.
yeah.
He said, "Today, we've understood the language
Mm.
by which God created humans."
Okay.
And that is
Wow.
after the scientists brought together by Al Gore and him in the United States were given the
Wow.
power to study and understand the human genome. And
Yeah.
so a lot about humans can be corrected
Mm,
by the means of their genome. And when I was a lot younger, I was working in an aisle in France. Was
yeah.
in a tube,
Mm,
you know. I saw a caption,
okay.
my inquisitive mind.
Mm,
It said, "One day our DNA will be our identity."
mm.
It wasn't too long.
Wow.
Today, our DNA is our identity.
Identity. That's
So I'm also
vibes.
looking for that time where humans will be genetically perfect.
Mm,
Even when accident happen genetically, you correct it immediately.
yeah.
That is medicine in its highest point.
Wow. Medicine at its
Uh,
peak.
I will wish to see those days come.
Yeah, so someone doesn't want us to just conclude. so so someone is asking a question: are there other interventions you carry out to aid a woman with fertility issues? So I think this is a really broad question. But yeah, are there other interventions you carry out to aid a woman with fertility issues?
Sure, a lot. That is all
Okay.
we live doing. Whatever needs to be intervened upon,
Mm,
we do that. It all
mm.
depends on the individual's condition.
Okay.
We do that all the time. Yeah. So
Okay.
I don't know exactly what she means by whether
Mm.
there are other intervention.
Like if there's a
Intervention.
fibroid, of course, like you said,
Oh
maybe
yeah,
they
to
would.
take out the
So
fibroids.
it just depends on whatever situation you present with.
Hmm.
They definitely will prefer a
Oh
solution to
sure. Oh
it.
sure.
Yeah. So this is the much you take for today. If you have other questions, just keep dropping them. We are going to be right here, same time for you tomorrow. So keep your questions rolling. If we're not able to address them today, we'll address them tomorrow, same time by 3 p.m. tomorrow. So I look forward to seeing you at dear viewers tomorrow by 3 p.m. Nigerian time. Yeah.
West
By
African time.
West African time. Thanks. Well, okay, yes, West African time,
Nigerian
please.
time.
Okay, it's true. I actually need to correct that because most Nigerians don't know how to keep to time. So yes, West African time. So it's now a Nigerian time of saying 3 p.m. and then we're appearing 4 p.m.
Oh yeah.
Yes, so West African time, 3 p.m. tomorrow. Bye. Thanks for watching.